Hello, and thank you for choosing to listen to this short webinar which contains information on COVID-19, which is relevant for cat owners. My name's Sarah Caney. I'm a UK-based specialist in feline medicine, and this webinar has been recorded on March the 27th, 2020. So please bear in mind that in this rapidly changing world, information may change depending on when you're listening to this webinar. If there are significant changes in the coming days, then I will plan to do an updated webinar. But please bear in mind, this information is based on what has been available to me on March the 27th, 2020. So firstly, what is COVID-19? Well, COVID-19 is the term used to describe the illness seen in people following infection with a severe acute respiratory coronavirus, SARS coronavirus 2. This is an illness that was first reported towards the end of 2019, hence being COVID-19 and not COVID-20, and was first reported in China, but has recently been classed as a pandemic since many countries of the world now are seeing problems with this highly infectious virus. The fatality, the death rate of this virus in people is usually about 1 or 2% based on our current knowledge, and that is much higher than the death rate seen with our typical seasonal flu viruses. But as you can see from this slide, and you will know yourselves from the news reports, unfortunately the fatality rates can be much higher in certain higher risk groups of individuals, and that includes elderly people and people that have other illnesses, what are called comorbidities. For example, people suffering from heart disease or diabetes mellitus. There is a lot of information online, and again we're all getting bombarded with news reports, but I've included here two websites which I think are useful ones for us to refer to. The World Health Organization is the top website, so that of course has a human focus, although there is some information also on animals. But the lower website that I've referenced here is the World Small Animal Veterinary Association, and this website has been working hard as well to put out updates and information relevant to veterinarians and pet owners. What do we know so far about COVID-19 and pets? Well, unfortunately, we don't know very much. There hasn't been, to my knowledge, widespread testing of in-contact pets, in other words, pets in the same household as people who have been confirmed to have this illness. At the moment, I'm also not aware of any reports of illness in pets affected by this coronavirus, so we don't know much about whether it is likely to be a significant cause of illness in pets, and indeed whether the virus can replicate, can grow in pets. All these questions are still yet to be answered. There have been some reports of the virus being isolated, so low levels of virus being present in some dogs in Hong Kong. But at the moment, again, we don't know very much about these dogs. I don't believe there was any illness reported in the dogs, and the levels of virus that were isolated were very low. So we don't know whether perhaps these dogs were carrying the virus in a sort of passive way, or whether they had a low level of infection. We just don't know. And I think at the moment, because quite rightly all of the testing and all of the hard work is focusing on people, we just don't know the answers to these questions. Could you catch COVID from your cat? Could you catch this coronavirus? Well, the honest answer is that we don't know at the moment, but it is possible, I believe, that this could be the case. So, for example, if you are self-isolating in your home, so you're not going outside, but if you have a cat that has access outdoors, then it is possible that that cat will come into contact with the virus in the environment or through contact with infected people. And we know that whilst it's a relatively fragile virus, it can certainly survive for several hours, maybe a day, on certain surfaces. So it is possible that your cat going outside could be stroked by someone who has coughed in their hand and they are shedding the coronavirus. And therefore, potential consequences of that could be that the cat could become infected with the virus themselves, and that may result in them actually shedding new virus. And as you can see on this slide here, I've put some information from the SARS outbreak in 2003, where in Hong Kong some scientists documented that cats living with infected people actually in some situations did become infected themselves and were able to shed new virus and potentially be a source of infection to others, although it wasn't thought that they were a significant route of transmission of this infection. In other words, there were no people suffering from SARS where it was felt that they acquired it from a cat. The human-to-human route of transmission was thought to account for all of those cases, but nonetheless, the scientists were able to show that these cats were infected with the virus and could make new virus, which could of course be responsible for transmission potentially in the future. It's worth mentioning at this point, if you're worried about your cat and illness in your cat, that the SARS coronavirus in 2003 didn't make any of the cats ill. So the cats were absolutely fine, but they were able to replicate the virus and act as a source of new virus. Another way that you may potentially come into contact with the virus via your cat is the bottom point here, where I've put the cat may act as a fomite. A fomite is typically an inanimate object that passively is transmitting an infection. So an example of a fomite in the household might be your cat's food bowl, where if your cat has an infection that is shed into their saliva, that could contaminate the food bowl, and then another cat coming to share that food bowl could become infected via the bowl rather than directly from the cat. And so there is therefore this possibility that for ourselves, if let's say your cat went outside, someone infected with the coronavirus coughed on their hand, stroked your cat came back into your house, you stroked the cat, potentially you could then pick up the virus on your hand, and your cat could have acted to transmit the virus, not through shedding the virus, not through replicating the virus itself, but as a sort of passive object, just really transporting the virus through the environment. In reality, I think this is going to be very, very unlikely as a route of transmission. So it's not impossible, which is why I've put it here, but I do think it's very unlikely. Also bear in mind that cats are fastidiously clean creatures, so they will be grooming regularly, and if they come into the contact with the virus, we don't know how long it survives on their coat for a start, but if it does survive any length of time, it will likely be groomed off by the cat. If you are in a household, though, where there are high-risk carers, for example, elderly people or people with concurrent illnesses, then it may be sensible, if you have a cat that goes outside and you know that there is coronavirus affecting people in your area, then perhaps you should limit or avoid contact between high-risk people and the cat during this period where we're worrying about the virus. Sensible hygiene, so hand washing with soap, does destroy the virus, so it is very sensible for all of us to wash our hands several times through the day, to avoid touching our faces, our mouth and any other mucous membranes with our hands. Always wash your hands before eating. All these things are going to help protect us as best as possible. If you have or suspect you have COVID in your household, then ideally your pets should be quarantined with you to limit the risk of transmission beyond your household. So if you know that you have been diagnosed with this illness or you suspect it in yourself, then this is really very sensible. And really critical information would be that if during that period that you are isolating as a household or an individual because of knowing or suspecting that you actually have this infection, if any animal in your household needs a vet appointment, then do make sure that your vet clinic knows your situation so that they can prepare appropriately for it. And this might be an example of where, for an emergency vet appointment, if you have a friend or a neighbour who is not suffering from this illness, if they are able to actually physically take your pet to the clinic, then that of course reduces the risk of you transmitting infection to any of the vet clinic staff. So that might, for example, entail you putting your cat into their cat carrier, securely fixing that closed, putting that on your doorstep, shutting your door, and your friend or neighbour comes to collect the cat and takes them to the clinic. And that just reduces the risk of you transmitting infection outside your household. Vet clinics are working very, very hard, I know at the moment, to support all of their registered clients. And whilst they may be closed other than emergencies, they are very much open for advice and support. And a lot of clinics now are offering online consultations. Our Royal College in the UK allows us to make prescriptions over the phone if we feel that is required in these very difficult times. So there are still a lot of things that your vet clinic can do as normal to support you and your pets. Of course, if there are any planned, what I would call elective procedures, so things that are not urgently required, for example, your cat maybe needs a booster vaccination in the next week or two, then these should be delayed. And if you're worried about whether a procedure that you're booked in for is elective or required, then of course speak to your vet and get some clarification. And they will all be very happy to talk to you. They may well be quite anxious like you about this whole situation, but they will be very keen to support you as best as possible. Of course, very important if you have any pets receiving long-term medical supplies, that you make sure that you do have adequate supplies in your household. You don't suddenly stop treatment unless the course of treatment has been planned and plan to stop, that you speak to your vets and they will be able to, as the human pharmacies have been able to as well, get your medicines to you. This is a poster that's been designed by a European veterinary association that just gives some advice, and much of which I've already mentioned to you in terms of visiting your vets. So key messages are: don't go to the vet clinic, of course, ring them up first or contact them via email to ask for advice. If a visit to a vet clinic is needed, then only one person should accompany the pet, and that person should be a healthy person, so not someone who is either known or suspected to be suffering from COVID themselves. Wait outside the clinic, phone the clinic to let them know that you're there, and follow their instructions. So some clinics are collecting animals from the car park, taking them into the clinic whilst the owner stays in the car, and then having a telephone consultation to collect the relevant data and obviously feedback information on what treatment has been prescribed, and then the animal is returned. So in other words, for many situations now, clinics are saying that the owners don't go into the building at all. There may be some situations where you have to go into the building. For example, if you have an injured animal that you're carrying in your arms and you can't just leave it on the doorstep, you may need to go into the building. And if that is the case, then you should avoid contact with any surfaces and people whilst you're in there. Maintain a safe distance from other people, at least 2 meters. Disinfect your hands on arrival and on departure, and just avoid touching things, so to minimise any risk of cross-contamination and transmission of infection. This is just a list of some examples of genuine emergencies, and I think you will all know for many of these you won't have a question in your mind as to whether you need to contact your vet. Clearly, if your cat or dog is unconscious, not responsive, you are going to know that you need to speak to your vet clinic urgently. An inability to pass urine, if your cat is straining and unable to pass any urine at all, is a very genuine emergency as well, and that you need to tell your vet clinic about that as soon as possible, because that is potentially fatal within 24-48 hours. So that would be another example where really urgent contact is required. Loss of appetite can be an emergency if it is persistent and complete, and again, if not sure, speak to your vet. Similarly, if your cat is repeatedly vomiting or has very watery diarrhea, is not eating and drinking, and you're worried they're becoming dehydrated, then that too would constitute an emergency. And all of these, phone your vets first so they are prepared for your arrival, but also take any urgent advice that they are able to give you over the phone as well. Some other online resources that you might find helpful in these tricky times would include International Cat Care's website, which has a lot of information sheets on almost every illness you can imagine in cats. My own website, vetprofessionals.com, has a lot of information on it, so please do look through that, particularly for chronic illnesses, things like kidney disease, hypothyroidism, urinary tract disease, for example. And the bottom link is for the Blue Cross, a UK animal charity website, and they have some first aid advice on their website, which might be the sort of thing that's useful to look at today, maybe download for further reference, so that you have that available if you need it and are feeling worried about your cat. So in summary, we want to put off anything that can be put off. Don't worry if your cat's booster vaccination is delayed, because their immunity typically will obviously last longer than the period that is recommended by the manufacturers, because they are erring on the safe side. So don't worry about leaving that a little bit longer. It can be caught up with at a later date. If you have any worries or any questions, do speak to your vets. They are all open in the sense of accepting phone calls and emails, and they really want to be able to support you as well. And make sure that you do keep up the vigilance on hygiene at home. Normal disinfectants and hand washing do destroy this virus. From a cat relevance, avoid phenolic compound containing disinfectants. This includes products like Dettol, things that make water have a cloudy appearance when you add it. These are toxic to cats. If this is the only disinfectant you have in your house at the moment, then if you have cats, I would say try and rinse things after disinfectant to remove the Dettol from it. And of course, don't allow your cat to come into contact with any surfaces where Dettol has been used, because it is poisonous to them. Thank you for listening. I hope you found this helpful. If you would like a copy of the slides I've used, then please drop us an email. And in the meantime, I wish you and your family and all your pets the best of health, and let's hope we can all get through this tricky time as quickly as possible. Thank you very much.